Welcome, esteemed members of the anesthesia community and fellow anesthesia enthusiasts, to another enlightening episode of Anesthesia Updates. Today, we're entering the captivating realm of robotic-assisted surgery from the anesthesia perspective. It's a thrilling journey through the technological marvels, the unique challenges, and the crucial role of anesthesiologists in this advanced surgical landscape. Our journey began in the 1950s, an era when early concepts of using robotic systems in surgery first emerged. Picture this: remotely controlled mechanical arms delicately performing simple surgical tasks. A glimpse into the future, indeed. Fast forward to the 1980s, and we meet the Puma 560, the first true robotic surgical system introduced in 1985 by Victor Skaneman. Initially designed for neurosurgical biopsies, this remarkable invention laid the foundation for robotic surgery as we know it. Now, let's talk about the late 1980s when the Robotic system made its debut. It was a game changer for orthopedic surgery, specifically in hip replacement. Robotics was starting to find its place in mainstream surgery. The early 2000s ushered in a revolution with the Vinci Surgical System. Developed by Intuitive Surgical Incorporated, this groundbreaking technology earned FDA approval in 2000. It offered minimally invasive procedures in various specialties like urology, gynecology, and cardiothoracic surgery. Imagine improved precision, control, and mesmerizing 3D visualization at the surgeon's fingertips. The mid-2000s brought with them the expansion of robotic surgery into new horizons. Urology, gynecology, and general surgery witnessed a surge in robotic applications. Prostatectomies, hysterectomies, and bariatric surgeries became commonplace, promising a brighter future for surgical patients. The 2010s were all about advancements and wider adoption. Robotic surgery technology continued to evolve, boasting enhanced robotic arms and tools. Surgeons gained valuable experience with these systems, translating to better patient outcomes. The adoption of robotic surgery grew significantly. In 2019, the Enhanced Surgical System, developed by Transentrix, entered the scene with FDA approval. It offered an exciting alternative to the Da Vinci system, particularly for minimally invasive procedures. By 2020, robotic surgery had a global presence. It was no longer confined to a specific region, it was a worldwide phenomenon. Complex surgeries were being performed across various continents, and new applications were continually emerging. And finally, in 2023, robotic surgery had firmly established itself in many hospitals and surgical practices. Surgeons were pushing boundaries, exploring microsurgery, and even telesurgery. The technology was evolving, aiming for greater precision, smaller incisions, and improved patient outcomes. Throughout this remarkable journey, robotic surgery faced its share of challenges, from the high costs to the need for extensive training and the questions surrounding long-term patient outcomes. Yet, it also displayed incredible potential, promising reduced invasiveness, shorter recovery times, and enhanced surgical capabilities. The Da Vinci Surgical System comprises three main components: surgical cart. The cart has 4 arms, with the first 2 representing the surgeon's right and left arms to hold instruments, the third positioning the endoscope, and the optional 4th arm for additional tasks. This design eliminates the need for a patient-side surgeon. Most robotic surgeries involve a team of 2 surgeons. The surgeon at the console controls the robotic arms, while a skilled assistant at the tableside manages trocars, connects them with the robotic arms, changes instruments, and handles additional endoscopic tools. The console is where the operating surgeon sits to view the surgical field and control the robotic arms. The surgeon's hand motions are translated into surgical instrument movements. foot pedals on the console enable functions like disengaging robotic motion, switching between robotic arms, adjusting the camera, and controlling energy sources for cauterization or ultrasonic instruments. The optical tower houses the necessary computer equipment to integrate optical channels, providing stereoscopic vision. It also runs the software responsible for controlling the kinetics of the robotic arms. In summary, the benefits of the robotic surgical system include a unique three-dimensional stereoscopic view of the operative field with adjustable magnification and a stable camera platform directly controlled by the surgeon. Restoration of 3 additional degrees of motion compared to conventional laparoscopy, enhancing the surgeon's precision and dexterity. Tremor filtering technology and motion scaling capabilities that further improve surgical precision and steadiness during procedures. Imagine being suspended in a seemingly gravity-defying position for hours on end during a surgery. That's a reality for patients undergoing robotic procedures. This extreme positioning, such as the steep Trendelenburg position, can take a toll on their respiratory system. To counteract this, anesthesiologists carefully adjust the patient's ventilation, ensuring their oxygen levels remain stable throughout the operation. It's not only about the patient, it's also about monitoring for potential hypoxia, especially in elderly patients or those with compromised respiratory function. Robotic surgery procedures often clock in at longer durations compared to traditional surgeries. And here's where the anesthesiologist's expertise truly shines. They closely monitor the depth of anesthesia using sophisticated tools like the minimal alveolar concentration, MAC, and MAC brain. These tools help ensure that patients remain at just the right level of anesthesia, reducing the risk of complications due to over or under anesthesia. Now, let's talk about another challenge that anesthesiologists face: the spatial restrictions in the operating room. Robotic systems, with all their advanced technology, take up quite a bit of space. This can hinder the anesthesiologist's access to the patient and even obstruct their view. But they adapt and innovate to make the best of the situation. Future generations of robotic systems are expected to incorporate boom-mounted options, potentially improving spatial management. Our final challenge revolves around the learning curve of surgeons. Robotic surgery isn't something one can just pick up and perform like a routine procedure. It demands specialized training and skill development for surgeons to operate the equipment effectively. That's where anesthesiologists play a vital role in emphasizing the importance of training. In the world of robotic-assisted surgery, it's not just the surgeons who take the spotlight. Anesthesiologists work tirelessly behind the scenes, managing extreme patient positioning, the extended duration of surgeries, spatial restrictions, and the surgeon's learning curve. Robotic-assisted surgery has indeed ushered in a new era of precision and minimal invasiveness, but it comes with its own set of challenges. Let's break it down for you: proper positioning and padding, protecting patients during lengthy procedures. Imagine being in surgery for hours, placed in an extreme position like Trendelenburg. It's vital for surgical access, but it can also affect your body. Anesthesiologists have to ensure your comfort and safety, including adding straps and shoulder support for a patient. Prolonged Trendelenburg positioning can put the patient's eyes at risk. So, they apply eye ointments and protective covers to prevent any damage. Patients with dental prosthetics need special care. Dental guards are used to keep the patient's pearly whites intact. And speaking of unique challenges, in transoral surgery, the equipment is positioned near the patient's face, making it even more critical for anesthesiologists to ensure patient safety. They have very limited accessibility to the patient's face and equipment, which adds an extra layer of complexity to the procedure. Preventing nerve compression, ensuring patient comfort. Prolonged positioning can lead to nerve compression, causing discomfort. Anesthesiologists are on the lookout for any signs of discomfort, and they use padding to ease the pressure points, along with securing adequate length for all monitor wires. Securing tubes and lines, ensuring airway and vascular access. Now, imagine securing vital tubes and lines during all of this, especially in the Trendelenburg position and transoral surgeries. They make sure the endotracheal tube stays in place for proper breathing. And they use longer lines for vascular access to keep the surgery uninterrupted. Additionally, they ensure that the urobag is visible and emptied regularly to avoid any issues, and every vascular access point is equipped with 3 ways to control every port. Let's start with the concept of depth of anesthesia. Imagine you're at the dentist's office, and you need a local anesthetic to numb a tooth before a procedure. Now, in robotic surgery, this concept becomes even more critical. Enter bispectral index monitoring. It's like a magic wand for anesthesiologists. This monitoring provides real-time feedback to measure the patient's level of consciousness during surgery, ensuring they are neither too aware nor too deeply sedated. Picture it like a volume knob on your favorite music player. Anesthesiologists can fine-tune the anesthesia levels to make sure you're in a comfortable, safe state throughout the robotic surgery. Robotic surgeries often stretch over long hours, and a lot of anesthesia agents can be used. But what if I told you there's a way to reduce both anesthesia agent consumption and environmental impact? That's where low-flow anesthesia comes into play. Low-flow anesthesia is like eco-friendly anesthesia. It's about using less gas, which means fewer resources wasted and less exposure to greenhouse gases. Think of it as driving a hybrid car. You get where you need to go while making a smaller carbon footprint. In robotic surgery, it's about optimizing gas concentrations and flow rates, ensuring a more efficient and eco-conscious process. During long robotic surgeries, patients are often tilted with their heads lower than their feet. This position can lead to some challenges like atelectasis, lung collapse, and facial edema, swelling. To combat atelectasis, modern anesthesiologists use advanced mechanical ventilation strategies. These strategies involve carefully managing the patient's lung function during surgery, ensuring oxygen levels are maintained, and lung collapse is minimized. Meanwhile, to tackle facial edema and cerebral congestion, anesthesiologists employ restrictive fluid therapy. This involves optimizing 4 fluids to keep the patient's fluid balance in check, reducing swelling, and maintaining proper cerebral blood flow. Plus, patient positioning and sequential compression devices help in preventing unwanted swelling. Long surgeries can lead to another issue, a drop in the patient's body temperature. That's when patient warming techniques come into play. Picture this. You're on an operating table, and you've got a warming blanket gently keeping you warm, like a cozy winter's night. That's what these techniques feel like. Heated intravenous fluids, conductive warming mattresses, and forced air warming blankets are some of the tools that anesthesiologists use to make sure you stay comfortably warm throughout the procedure. It's like having your own personal heating system during surgery. We'll take a closer look at various procedures across different surgical specialties and the unique anesthetic considerations that come with them. Our first stop is in the world of urological surgery, with a focus on prostatectomy. This is one of the most common applications of the Da Vinci robot. However, it presents some unique challenges for anesthesiologists. Patients are positioned at a steep Trendelenburg angle, often exceeding 30 degrees. This affects their pulmonary and cardiovascular systems. To maintain patient safety and well-being, careful attention is given to factors like lung compliance, central venous pressure, and intracranial pressure. Moving on to other urological surgeries, such as robot-assisted radical cystectomy and robot-assisted nephrectomy, we find that they share some common anesthesia strategies with prostatectomy. However, patient positioning and considerations related to CO2 insufflation may vary. Ensuring optimal patient care while adapting to these specifics is crucial for success. Now, let's transition to the world of gynecological surgery with the Da Vinci robot. The anesthesia considerations are similar to those in urological procedures, with one notable difference: the Trendelenburg position is typically less steep. This adjustment allows for a comfortable and safe surgical environment while preserving the patient's pulmonary and cardiovascular stability. Shifting gears to a completely different realm, we have transoral robotic surgery for head and neck procedures. Anesthesia for these cases involves safeguarding the patient's eyes and teeth. Additionally, special attention is paid to patient positioning, which can vary depending on the specific procedure. In some cases, tracheostomy may be required to ensure a smooth and successful operation. Our next destination is the heart, with a focus on robotic cardiac surgery. The unique challenges here revolve around accessing the thoracic cavity and maintaining cardiac function. Patient positioning is usually supine, with single lung ventilation and CO2 insufflation. The use of cardiopulmonary bypass and careful cannulation strategies are essential for a successful procedure. Pharmacological paralysis ensures patient immobility, making it a complex yet critical part of the process. Finally, let's explore the world of robotic thoracic surgery. Procedures within the chest come with their own set of considerations, especially concerning patient positioning. Patients are typically placed in a lateral decubitus position, but this can pose risks like neuropathy and nerve compression. Anesthesia providers must navigate these challenges while ensuring patient safety and well-being. In conclusion, Da Vinci robot-assisted surgeries have revolutionized the medical field across various specialties. These innovative procedures offer precision and minimal invasiveness but require unique anesthesia strategies. Anesthesia providers play a crucial role in ensuring patient safety, optimizing surgical conditions, and minimizing potential risks. Understanding the specific considerations for each type of surgery is vital for the successful outcome of Da Vinci robot-assisted procedures. Finally, Da Vinci robot-assisted operations have changed the game for many different kinds of surgical procedures. Although these innovative techniques are less intrusive and more precise than ever before, anesthesia professionals must modify their practices to accommodate them. Specialists in anesthesia have a crucial role in protecting patients, improving surgical outcomes, and reducing risks. It is crucial for the success of Da Vinci robot-assisted treatments to have a thorough understanding of the specific concerns for each kind of surgery. Thanks for joining us on the exploration of anesthesia for Da Vinci robot-assisted operations.